is my chiropractor, and I wanted him to come on here because you're upside down.
Well, I've never done that. No, you're upside down. Okay.
No, he knows a lot more about this stuff than I do. So, if you want to go ahead and start with like where you got trained and like what your expertise and stuff is.
Sure. Well, I'm Dr. Kevin Osborne. I'm at Smith & Jones Chiropractic in Dunbar, West Virginia. I have a pretty big Facebook presence, so if you need anything, go on and check the Facebook videos. But anyways, I grew up in Bell, West Virginia, and decided to go to chiropractic school kind of at a later age. 31, so getting up there. But
Watch out now.
I went to Palmer Chiropractic in Davenport, Iowa, which is where chiropractic got its origination and where it all started. So, in chiropractic care, we use like a holistic approach. We believe everything that happens in your body is directed through the spine, right? So, for instance, one analogy that I like to use is you can compare it to like if you're watering your flowers, right? So you have your hose turned on and you're watering your flowers and everything's going great. Then somebody comes along and they step on it, on the hose, or they kink it in half. What happens to your flowers? Eventually they die, right? So that's the same with all of your organs, is if there's improper nerve flow coming from your spine, which, there's nerves on both sides of your spine that flow to different muscles and organs and ligaments and tendons, and nothing in your body happens unless your spine tells it to or allows it to. Then if there's interference there, then something's not going to work properly. And a lot of times people use pain as a reason to go to the chiropractor. Well, pain is actually a side effect or a reason as to why your body is allowing you to know or figuring out as to why you're having problems, right? So there could be deeper issues just from low back pain, right? There could be visceral type problems, which is in your organs. There could be neurological type symptoms. So all of this kind of goes hand in hand. So I say all that to say that every little thing that you feel, no matter what your issue is, can be helped by chiropractic care. Now, I'm not saying chiropractic care can cure anything. We don't cure anything. We adjust the body so it can properly and better absorb the issues and react to the outlying issues. So, specialization. I specialize in making you live the healthiest lifestyle that you possibly can. Because all too often, people choose to be unhealthy. We're a nation of sick care, and we need to be a nation of healthcare and be proactive about everything, including Marfan Syndrome.
Well, that's where I was leading into.
Yeah.
How many of us have you seen?
I've had, well, of course, when you came in, I started talking to you, and I had no idea from the looks of you, honestly, that you had Marfan's, and you told me, and you remember my reaction.
Yeah, same as everybody.
Right, but I will say I jumped on board with it a lot quicker than some, simply because I've seen other Marfan patients that don't fit the mold, right? You know what I mean? Like you're not tall or extremely thin or elongated fingers and toes and things of that nature. But Marfan is a connective tissue disorder primarily, and in and of itself, it can cause pain, right? People can have pain for very many different reasons. But when it comes to Marfan syndrome, we kind of take a step back and we kind of look and say, well, we don't want to address it chiropractically because they're already moving too much anyways, right? It's a hypermobility issue. When in fact, if you adjust something that's hypermobile, then you need to get it back in its proper place so it can heal better and it can react better. And that's kind of the approach that we take. So how many have I seen? I mean, truthfully, you're the only one currently that I treat, but I have seen several Marfan patients in previous years.
Your long life.
Yeah, I'm 31 years old. I'm knocking on, I'm gonna get my West
So,
Virginia Mountaineer card here soon.
so I know when I came in, we did a lot of X-rays. So, do you want to
Mhm.
go over like what the testing is to know the right treatment?
Sure. So, first of all, we practice a form of chiropractic here where we do X-ray the majority of our patients, regardless. If you come in, X-ray is just another tool for us to be able to help that patient and figure out what's wrong with them. It's like a blueprint of their spine and their body, so we can get a better idea of what's actually going on with them and how better to treat them and diagnose them. But
Mm-hmm.
with Marfan's, there can be some instability in some of their spine, especially the upper cervical instability,
Mm-hmm.
and that can lead to the migraine headaches that you get. That can lead to the dizziness spells that you get. That some people say, oh, it's just high blood pressure causing that, or it's your diet, which all can go hand in hand, and it can cause
Mm-hmm.
that. But a lot of times in people with Marfan's, upper cervical instability, the ability of your vertebra in the upper cervical spine to move left or right or up or down or back and forth. Um,
Mm-hmm.
we don't worry about that, but we take consideration into that, especially when we do an A to P open mouth view. So that's where you stand with your head to the back and you open your mouth, and we shoot the central array right through there, so we can kind of see if there's any instability in the upper cervical spine. And then the other X-rays we take is just a normal A to P cervical, lateral cervical. We definitely like to see what your curvature looks like, to see if there's anything causing pain or discomfort from there. If anything can be explained by that. And 9 times out of 10, honestly, if you have a straight cervical spine and you get headaches and we work on that curvature over time, you're going to get better.
Mm-hmm.
And then we do an A to P front, which is a front view of the thoracic spine, and a lateral of the thoracic spine, and an A to P lumbopelvic and a lateral lumbopelvic. And a lot of that is just so we can see the curves and see if there's any degenerative disc disease, see if there's any arthritis or any type of arthriticity in there. But especially in Marfan patients, we take special close attention to the upper cervical spine.
Yeah. And when do you decide? We started with the Activator for me. When do
Mm-hmm.
you decide if it's safe to go past that?
Um, it's really patient by patient basis. If there's no reason that I couldn't, that you can't adjust someone with Marfan syndrome, moderately aggressively. We started with the Activator on you. One, you were a little hesitant about the whole thing in the first place.
A little bit.
So we started out a little, kind of just to acclimate you to it, let you know that, hey, this is going to do nothing but help you. And then we get a little more aggressive, especially, but, like I said, patient by patient case, if I may speak to your case, you've had some hip problems and things like that, I think, that you've dealt with. So we wanted to go a little bit lighter with you just because, sometimes with Marfans, you can have ligamentous laxity, like some lax ligaments throughout your spine and the rest of your body. So, if you go pushing too hard, sometimes you can strain something and then it kind of turns you off of the whole thing. And we need you in for the long haul if you really want to get fixed up,
Yeah.
I'm
Right.
not saying you got to come in every day for the rest of your life. That's absolutely ridiculous. But
Just once a week.
every day.
So, what other tools do you use? I know I saw like the ultrasound machine and I have the acupuncture.
Sure. So acupuncture, we do ultrasound therapy, which has an infrared heat that helps with a lot of inflammation, which Marfan syndrome people with Marfan syndrome do have inflammation throughout their joints. It's connective tissue disorders, just like Marfan syndrome, Ehlers-Danlos, things like that. Also, you can get TINS units therapy, which helps with muscle spasms that those tight muscles that you feel, like crawling, cramping type, wormy feeling.
Yep.
Helps with that. And then massage therapy is very important too. We have 4 massage therapists here, and working with a massage therapist, especially if you have Marfan's, that you can hurt every now and then.
Yeah.
So just working that soft tissue aspect of it can do wonders. And then ice is important. You really never want to use a whole lot of heat, especially when you're dealing with pain, because it's usually where you find pain, you find inflammation. Where you find inflammation, you find pain. So heat, especially when it's close to the spine or it's a problem from the spine, ice will do a lot more than heat.
Well, that's great, because that's all I use.
Yeah.
Now, why do you think that people, because I've seen it a lot on the bigger groups about don't ever go to the chiropractor if you have Marfan syndrome. Why do you think that that's a thing?
Well, I think a lot of times people turn, if you have a disorder, especially when it comes to hypermobility, people, anytime you think of a chiropractor, you think of something you've seen in a movie where they're like, right, cracking you all up and down. And it's just really not like that. We're very specific. Chiropractic is, BJ Palmer, or one of the Palmers said, chiropractic is specific or it is nothing. So therefore, by that means if we move things that don't need to be moved, then we're not doing you a good service. We're doing you a disservice. So if something is not moving and is immobile, we move that. So, why do people say don't go? I can't answer that. A lot of times people fear the unknown. And as a whole, chiropractic is not a mainstream tool that people utilize. But I'm going to tell you, if people utilize chiropractic care more for overall health, right? I just did a Facebook Live video about stress and anxiety. Studies have shown that stress and anxiety, if you're under chiropractic care, you can deal with it a lot better. Like I said in the beginning, we don't cure anything, but we allow the body to adapt a lot better to its problems. And that's with anything. So, chiropractic care is needed for everyone.
Mm-hmm. Is there any condition that you wouldn't treat?
Nothing that I've ran into, I wouldn't give it a shot. There's contraindications to everything. For instance, if a pregnant woman walks in and says, my back hurts, I'm not slapping a TENS unit on her.
Right.
You know what I mean?
Yeah.
Or if someone comes in with a pacemaker, I'm not putting them under ultrasound. There's contraindications that we are trained in and should be trained in. So, yeah. But no, there's no serious condition that I can't treat. So
I'm guessing you have a patient.
No, I got about, a couple, but we're good for another minute or so. If you have any more questions.
How about, I have several, so we might have to have you back here. How
we could do it again.
Like
This is
occupational
Marfan
therapy?
Awareness Month, by the way.
Yeah, I know.
Okay.
Occupational physical therapy, how does that kind of coincide with what you do?
I'm not an expert in occupational therapy, I'll tell you that. So, getting you under, there is motion in life and there is life in motion. Okay. Mm-hmm. You're no stranger to the fact that if you have Marfan's, you don't move as well. You can stretch a lot easier sometimes, but you don't move as well. You have a hard time moving around. Occupational therapy can help get you back into that. Absolutely. They can help with range of motion. They can help with getting back from, if you've had any surgery, just like physical therapy, occupational therapy, absolutely. If physical therapists and chiropractors don't work hand in hand, then this is going to continue to be a world full of people that are just ready and settled to take a pill for a problem. Yeah. And they need to work hand in hand. And they should. And we do. We refer people to physical therapy all the time. And we have physical therapists that refer to us all the time.
But that's just how it should be.
Oh, yeah. Just like we have neurologists that refer to us. We have pain clinic doctors that refer to us. And we do, vice versa. If the patient needs, it's the benefit of the patient. What's in the best interest of the patient. Has to be. Anything else, then we're doing a disservice.
You could have patients like me and everybody they go to, they say, don't do anything. You don't need PT. Just basically go to bed rest again at,
Right.
what, 8 months out?
Well, you've got a life to live. Everybody has a life to live. And
I
our
mean,
job is to let you live that life at its optimal level. And if we can't do that, then are we really doing our job? You know, I mean, there's some people, honestly, there's some people that we truly say, you know, if it's somebody with a very, very terrible, terrible problem and they've had it for years and years and years and years, and they finally decide to come in when they're 75 years old, hey, you know, we can manage this. We can't fix it.
mhm,
You know what I mean?
right.
There's a difference in managing and fixing. So
Yeah. Well, and you're more Eastern minded, is that correct? Like
Eastern
Eastern
minded,
and Western
as in,
medicine?
sure, as in like holistic health.
Hmm.
Chiropractors, sure, absolutely. Now, you know, there's different philosophies of chiropractic, absolutely. I believe that God created the body to heal itself and take care of itself. And we have to be able to put that body in the best scenario that it can be in order to do just that. And with diet and lack of exercise, all the medications we have readily available at the drop of a hat, with all the drive-throughs, people don't take care of themselves anymore. And if you came in here, not you, but if a patient came in here and did all of that stuff and all the bad things that they could do and expected me to fix them 100% without putting any effort into it themselves, then they are in for a rude awakening, because I'm going to tell you, you got to take care of yourself too.
Hmm.
And if you
Well,
listen
I
to me,
know.
we're going to do it.
Well, I know I have like 5 or 6 different type of braces after seeing you.
Yeah, it helps you. I
It
mean,
does.
yeah. So you
Yeah,
got to do what you got to do.
I did a thing on pain modalities the other day, and I was
Mm-hmm.
showing a lot of them, like the one that pulls your shoulders back and everything.
Oh yeah, yeah. Well, I'm telling you, just real quick, you were up to how many squats a day before your hip surgery?
It was like 250 or something, something
You
crazy.
like that before you came to me? Yeah. Were you like that before you came to me? Not really.
No, no, I could do like 10
Okay.
maybe.
Yeah. So we get you moving.
Hmm. Yeah, now I'm just kind of in this stationary funk.
Yeah.
So,
We'll get you back
so
out of it.
hopefully, well, hopefully,
Hmm.
I like to like kind of forget what they say and do my own thing.
Yeah, I know. I know. That's all right.
So, all right. Well, I know you have patience, so we'll let you go. And like I said, I do have more questions here, so maybe we can
Sure.
come back and do the rest of them in a different time.
Absolutely. That works for me. We could do this, quarterly thing if you want to,
Yeah,
like that.
that'd be great. So,
Okay.
just to have a little plug, go ahead and tell them again where you're located
Oh,
and your
sure.
contact information.
Sure. I'm Dr. Kevin Osborne. I'm at Smith and Jones Chiropractic in Dunbar, West Virginia. We have a Facebook page. It's Smith Jones Chiro, I think, something like that. I don't know the line. Just search Smith and Jones Chiropractic, Dunbar, West Virginia. Find our Facebook page. There's plenty of videos on there to help with exercises, motivation, stretching, healthy diet, exercise, anything you can think of, I've done. And like I said, we're in Dunbar, West Virginia, and if all our contact information is on our Facebook page, as well as our Instagram, and
Hmm.
I can't remember the Instagram thing, so we just started it. So
Remember it either.
Smith Jones
I
Cairo,
should be able to link them,
yeah, Smith Jones
hopefully.
Cairo, I think, and then we're
Okay.
getting a website too. We're getting ready to start a website up, and I don't know it yet, so we're going. We're stepping out of the old school and we're stepping into the future. It's going to be like the Jetsons up in this place.
Well, that's good. I mean,
Yeah.
I know that I share your videos all the
Mm-hmm.
time, so
Awesome.
there should be people on here that have already seen your face a lot,
Sure.
so you shouldn't be a stranger.
I try not to be.
All right, well, go see your patients, and thank you very much for sharing your time with us.
All right. You're welcome, Lindsay. Thanks for having me.
All right, thanks. Bye.
All right. Bye.